Welcome to Optimized Health. Welcome back, that is. We are on episode 61, if you can believe that. Episode 61. And today we have a special guest in-house. We have John Fee, and he is with Change Wellness. How are you, John?
I'm doing well.
Doing good.
Besides it being a little cold outside.
Yeah, I'm not a fan.
Yeah.
But
Me either.
I'm not a fan. But that's okay. That's okay. It's a part of it, isn't it? It's a part of it. So how did you come to be an owner in Change Wellness? Tell me a little bit about yourself.
Yeah, so I'll back it up. I'm a chiropractor by trade. It is my second career, so made a big life change at the age of 30, literally my 30th birthday.
Sometimes things happen like that.
Drove to chiropractic school from Baltimore, Maryland, all the way to Port Orange, Florida.
Oh, wow.
So it was a big move, yeah. And so it started with that journey, and then just kind of fast forward, graduated, and then at the graduation time was not the best timing. It was March 2020.
Oh,
so
no,
that was
COVID.
Yeah. But it was kind of a blessing in disguise in a way too, because I was doing a preceptorship with somebody I knew I'm from Pittsburgh, Pennsylvania originally. And that's where I knew this gentleman from. And he had his own practice, been in practice for 5 years. It was very rehab based. So a lot of exercise was performed there. It was kind of aligned with my values as well as how I wanted to practice.
Sure.
And so started to work with him and learned a lot, even when we were slower through some of those different changes we all went through during the COVID era.
Yeah.
But like I said, I got to learn a lot, and it was multidisciplinary. So we did have a nurse practitioner inside, and then as well as a physician who would come in usually once a month for different injections we would do with patients. So once we got to a point in that business, the owner was going to move back home to Pittsburgh. I knew I needed to make a change. And at that point, my wife, who's a physical therapist, had already just applied for her LLC and was slowly bringing on new clients and patients while she was also working part-time at a nursing home as a PRN.
Oh, goodness.
And so it was a lot of different moving parts at that point. Yeah. And then I was just like, well, I need to figure out what I'm going to do. So literally a few months after she applied for her LLC, I applied for mine. So we work as Key to Change Wellness, but I'm technically Key to Change Chiropractic. So
Understood.
We have two different business names, but we really fall under that Key to Change Wellness. And that's how it came to be. Working under Key to Change Wellness. And my wife specifically chose that name thinking that someday, maybe far along, that I would work alongside her. But we didn't know it was going to be so soon.
Look at how like that woman's intuition just kicked in right there, and you didn't even know what was coming.
I know.
She did.
And now she has to deal with me every day. So
she's welcome.
Yeah. So that's how it came to be. And, obviously we don't get taught a lot as providers about business and running a practice. So that is a big change. And I got to give, a lot of kudos to my wife. She's very business minded in that sense.
Yes.
I'm more of a social butterfly where I can go set up meetings with people and get to know people. But she's really the backbone that makes that go, because I went into chiropractic school to be a chiropractor,
right?
To run a chiropractic business.
Understood.
So that's
a lot of I think a lot of practitioners see that way, and now they're seeing themselves, to your point, after COVID, owning their own businesses and running their own practices, and doing that in a way that allows them to treat their patients in an appropriate way that they see fit and that match their model and who they are. And so that forces you to be a business person where you're like, I just want to sit right one-on-one with my patient and, and solve their problems. And then you have this whole other animal over here called a business. So that's definitely something we've seen come as a product of COVID for sure.
Absolutely. And back to what you said with one-on-one, that's exactly how we do practice. So I always like to have a conversation with patients before they come in to let them know that, hey, just I want to make sure it's the right fit for them and, right fit for us, because we do practice in a one-to-one setting. We are cash-based providers. Mm-hmm. So we just don't want it to be a shock to any patients. Because usually when you walk into a brick and mortar, whether it be a physical therapy office or chiropractic office, you're one of many. A lot of times you go to the waiting room, you're waiting there. Whereas this is all your time is with myself. And, if you want to talk, great, we can talk. If you don't want to talk as much, great, I'll just treat you. But we want to get you better in a faster way. And a lot of times when there's no outside noise and we can just be direct and to the point, that's when people get better faster.
So tell me a little bit about, if you've made this life change at 30, did you just come up with, you know what, my favorite thing to do is go get twist turned and popped by my chiropractor. I think I want to be one of those. Or what was the story behind that?
No, yeah, there is a big story. So I had always been an active individual. My father was a high school basketball coach, coached my brother and I. I always joked that I was the injured one, so it led me to this career. And then my brother coaches college basketball, and he was never injured. That's why he's in that career. So, but I did have, knee surgery, foot surgery, a couple of things that just, I was always injured, and even a stress fracture in my low back. So it was very frustrating at times. And I wanted to ensure that nobody else, maybe if we could prevent it, that would be great. And that my first visit to the chiropractor wasn't until I was 22 years old. And it was pretty eye-opening. Yeah. Because his first question to me was, after he assessed my pelvis, have you ever had any knee issues? And I was like, yeah, I had knee surgery at 17. And it was just, he's like, well, your pelvis is so out of line and out of whack that probably led to it. And it was a micro trauma basically to my knee. So it was just repetitive pounding from basketball on one side.
Oh my goodness.
So that really opened my eyes to it. And he was a great chiropractor too. So luckily, spent time with him, got to know him, and he kind of took me under his wing. And so I was always, attracted to that lifestyle too, because then it was part of my lifestyle. Yeah. I didn't go religiously, but I would periodically go when I felt like I needed an adjustment. Huh. And that's kind of like what put it in the back of my brain. And then fast forward, I continued with my safety and risk career, my first career. And then when I was living in Baltimore, Maryland, I was pretty just going through some life changes and pretty frustrated with my career at the time. And then one of my best friends, I got the news that, and I had a chiropractic visit set up. And one of my best friends, I got the news that he had passed away.
Oh, no.
And from there, I was like, you get that news, you don't know what to do. Mm-hmm. So I went to the appointment, which was just kind of, I was on autopilot. And that chiropractor in Baltimore went to the same exact school I went to, practiced very rehab, minded, how I wanted to practice. And he always encouraged me to go to chiropractic school, because I had already flirted with the idea.
Sure.
So, my buddy also was a small business owner, and he would have told me, stop whining about not liking your career and go do it.
Yeah.
So I kind of took that to heart, was like, hey, he would have told me to go do this. So I told my company that I was going to do it. And luckily they couldn't find anybody to replace me. So I worked there for about 6 months until chiropractic school started.
Yeah.
And went there. So
that's awesome.
Yeah.
At 30 to realize that, that take the leap. That's what I think. That's how when you make a big life switch like that, that is a leap. That's a leap of faith. It's a leap of, it's just a leap.
I mean,
and at 30, that's young to take that.
Well, and people thought it was, I don't want to say crazy, but they're like, you're going back to school for that long? Because it's almost 3.5 years.
Yeah.
And I was like, yeah, life's short.
Yeah.
Because after something like that, you're like, life's short. I'm going to do what I want to. And that's kind of,
good for you.
How that came about.
Good for you. So you mentioned shortly that your previous job was in risk management.
Yeah.
Tell me what that means. I think I know what that means, but tell me what that means.
So it can there's a lot of different moving parts with it, right? It could be, where they really look at risk analysis with the company of like what could happen and assess that from more of an insurance standpoint. And then there's a lot of safety managers, more so with like within an industrial setting or construction, where they're really trying to avoid injuries and incidents.
Okay.
Again, it kind of goes back to the insurance model because less injuries, incidents.
And this is for employees,
insurance.
right?
This is trying to help employees, but in turn, it's really the companies trying to save dollars.
Okay.
Because if they have injuries, then that hurts the companies because then their insurance premiums go up.
Understood.
Each year. So, but yeah, I was in more of I started out more in a corporate setting, a large company called Westinghouse. And I realized pretty quickly it was a good first job, but there's a lot of engineers there. So people's injuries were very, I don't want to call them minor, but there wasn't a lot of like big things that could go wrong.
Because they were mostly sitting in a
pretty much, yeah.
desk.
So you're worried about paper cuts.
Yeah.
So
splinters.
Stuff like that. I was like, this is not what I want to do. So I got in more in the construction side of things.
Okay.
And actually even before that, it was more of the secondary education. So University of Maryland, we would deal with hazardous waste, radioactive waste, things like that I really had never been exposed to, but learned a lot about it.
Oh my,
and
yeah.
It was pretty eye-opening people don't think about what goes on at hospitals or the behind the scenes with laboratories, but there's a lot of things. And so we dealt with all of, mainly the waste aspect, but focused on that from making sure that laboratories were safe so that these scientists could do their work and better help individuals.
Wow. So. Okay. So how do you marry these two things? Because I'm also thinking about you saying that you're, in sports and athletic and eating right and, being very healthy and things. How do you marry risk management and chiropractic?
Well, back to what I was saying with my injury, right? Could have been prevented. We don't know exactly, but it could have been had I maybe been exposed to chiropractic care beforehand, or if somebody caught that, hey, your pelvis is out of alignment. We need to maybe make some adjustments or strengthen the body so that you don't have this problem with your knee.
Okay.
So I think from that standpoint, working with companies and trying to prevent these injuries before they happen, or even having these conversations with employees, and that's the biggest thing we notice when we work with companies, is they'll bring stuff up that maybe they otherwise wouldn't have or ignored, but because they're there and that's their time slot with you, they're now talking about this issue. Oh yeah, I played golf over the weekend and I felt this twinge in my shoulder and I didn't know if I and that's where a lot of times we can kind of make an assessment, so to speak, on site and really triage it and say, hey, maybe whether it be us or if they want to go see another provider, you might need to get a second look at this because, maybe we did a couple of orthopedic tests and just gave us a little bit more information and they're really in a lot of pain with it. Well, it gives us, kind of a spidey sense that something else could be going on here. So it's really the prevention tool. That's where the, health and wellness piece plays into the workplace. And there's other benefits too, right? Because people are stressed out at work, right?
Yeah.
A lot of us are.
Yeah.
And just having that, whether it be 10, 15 minutes of whatever therapy they want goes a long way.
Right.
Because now they look forward to it every month. And also it sets companies apart because they're doing something maybe that their competition isn't. And they give that extra little perk to their employees. And the employees like that, or they brag about it to their significant other or whoever that, hey, our company does this. And we get a lot of positive feedback from the individuals we work with there too.
Does the risk management piece that you lived in a prior life, does that help you? Like if you have a patient, like if I came in and I'm like, okay, listen, this is happening. I think it's feel really weird. Does that risk management piece help you think maybe down a different road than like a normal, I don't want to say normal everyday chiropractor, but you know what I'm saying?
Yeah.
Like a normal everyday chiropractor may not think that way. You're thinking outside the box.
Well, I think it just makes me think differently, right?
Okay.
Whether it be good or bad, it just my previous experience, like any other chiropractor or provider, their previous experience is going to play into how they practice, right? Mm-hmm. So because I was in safety and risk management and being in the construction side of things as well, I can, if somebody comes in, they're like, hey, I've been doing this activity. A lot of times it's just in the health history that we can figure it out. Like, oh, I was painting overhead, or whatever they do for a career, knowing that position and understanding what, biomechanics are being used and what muscles are being used or overused, and then causing maybe a dysfunction or an overuse injury does help and plays a part in that. And then, I would say it definitely gives me kind of a leg up. And then also from a standpoint of, we do work with companies who also sit at desks all day. Mm-hmm. So I told you about going to Westinghouse and all the engineers. We would actually set them up and do ergonomic assessments.
Tell me what that is. That sounds fancy.
Yeah, I know. It's a long word. And it's a mouthful. But basically what it means is setting up the workstation to fit the employee.
Okay.
And their body. So we don't want to put strain and stress on the body because you're going to be sitting there for majority of the day, right? Mm-hmm. So that's going to put a lot of stress on, certain joints, certain muscles for prolonged periods of time. And I always use the example, if you pull your finger back, it doesn't hurt right away, right? Yeah. But if you did that for 8 hours, it's going to hurt.
Probably.
So it's the same concept with sitting at a desk. If your head's forward, because it's just not, phone, whatever it might be. So a lot of times having an extra set of eyes watching you and how you work, and I've done this with companies, they don't even realize they're doing it because they're in the day-to-day, in the weeds. Mm-hmm.
They just go in and do their job.
Yeah, that's what they're focused on. They're not focused on how do they feel. Mm-hmm. And so a lot of times it's kind of eye-opening to them too. When I can look at something and be like, okay, or their arms are way down here, so it's going to put strain and stress on their wrists, or their seat's not high enough, so it's going to put stress on their hips because now their knees are situated too high. So it's little pieces like that, because just like the chairs we're sitting in, they're pretty nice right now. Yeah. Right? They feel pretty good. And they have a lot of bells and whistles nowadays to where you can set it up. And sometimes you can't. If you get a really tall individual, sometimes they're not made for this individual. But we do our best with that to make them feel good. Because if they're going to be in that position for so long, we got to find ways to make them feel okay, or just even recommending little breaks throughout the day or stretches that they can do at their desk without having to lose productivity and leaving the desk.
I get it. So, usually using the bathroom is my break. Yeah. If I'm going to be real honest, it's usually like, oh, yeah, well, then we're going to get up and go now.
There you go.
But tell me what you think about, like, we sit a lot. And so our practitioners sit a lot. Tell me what you think about, what is your view on stand-up desks?
I have one myself. Okay. So
it can't be that bad.
No, I'm a big advocate for it. I mean, you're on your feet. I try to move around too. And obviously I do that when I'm with patients. But I always say, how do we find balance? So if it's you're sitting partially throughout the day and standing partially, so you're not wearing your feet out either, standing on your feet all day, just finding that balance. Because a lot of times what we see, and I think my wife would agree with me on this, even in the physical therapy realm, we see imbalances a lot of times. And they're not always a bad thing, but a lot of times those imbalances can lead to injuries or issues that we see in practice. And it's trying to basically alleviate those and get them back on track, those imbalances. Sure. So I'm again, to each their own, however you get your work done. And that's the same thing I say with sleeping when I get asked that every day. What's the best pillow or position? How do you get sleep? That's what you want, because that's what's important and that's what's going to help your body function better. So. That's
an interesting conversation, because in our realm of the world, sleep is a big thing. We want to know how you're sleeping, what's it feel, how are you waking up? Are you still waking up tired? Blah, 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 all this stuff. I don't think, I'm not a practitioner, so I can't say exactly what they say in their consults. However, I don't know that we necessarily talk about sleep position as much as how much, and like, when do you fall asleep, when do you wake up, and how do you feel when you wake up, kind of thing. Sure. So like, I would say, in my own personal land, I sleep with somebody, a very large somebody.
Yeah.
And so I feel like balancing off of those two people sometimes can be a little tough. Yeah. But tell me, what do you tell somebody when you have a conversation through them about sleep? Are you talking mattresses? Are you talking positions? What are you talking?
Well, they'll ask questions, right? Yeah. And there's no perfect pillow.
Sure.
Whoever invents a perfect pillow would be
now they called it
million.
That.
I know,
but they lied.
But they would be one of the richest individuals out there.
We'd all have one and never buy another one.
Correct. Mm-hmm. And then everybody would never have neck pain. But it's really, we're all designed differently. That's what it comes down to, right? Every body type is different. What we're going through, stressors. So I always ask, okay, what position do you like to sleep in? Mm-hmm. And, some people say side, some say back. Mm-hmm. The ones that are tough are the ones that lay on their belly and turn their neck. And I'm like, that's probably one of those challenging positions. Now, there are different pillows that are designed to kind of help your body out with that position if you are. So that's usually what I recommend for that, because there's kind of no getting around it. But I just recommend, if you're a side sleeper, and they're asking about pillows specifically, account for the distance between your shoulder and neck. That's what we want to account for, because if throughout the night, if your head's bent for a prolonged period of time, it might not hurt the next day, but if you do that night overnight,
and it's dead weight.
Yeah.
Like, it's not supported. You're just letting it all go.
And it's kind of back to the concept with the finger being pulled back. It's the same thing.
Yeah.
Just with some of the neck muscles. And then, it might not agitate you at first, but that first movement in the morning, all of a sudden, I threw out my neck, or crick in the neck. I always hear.
Crick in the neck,
And that's usually what I hear from patients, but that is kind of what it does. The muscles just kind of tighten up on them and doesn't allow the joints to move then. But I usually use that. And then if they're sleeping on their back, just accounting for, okay, we don't want as thick of a pillow because your neck doesn't want to be propped forward, right? So use a thinner pillow for that. And if you move around in every position,
toss and turn and all that, you're in big trouble.
Yeah, just use whatever feels the best to you is the rule of thumb there.
I always tease my husband because he's 6'3", I'm 5'4". So there's like a foot between us. Yeah. And so he always has a knee pillow. And when he doesn't have a knee pillow, he has that big old leg on me. And I'm like, you're breaking my hips with your big old legs.
It can happen.
It's one of those things. It's one of those things. So, so when you were talking about sleeping on your belly, I'm like, if I sleep on my belly, you can't put them big old legs on my hips. So, but nonetheless, there's a strategy. So in your particular line of work, how important is nutrition?
So it plays a big role.
Okay. Tell me about that.
We could do, everything. So in practice, I do a lot of soft tissue work with patients. It's not just adjusting. Sometimes it blows patients' minds when I maybe do one or two adjustments and the rest of it's, going over exercises or nutrition or, just talking about stretches, whatever it might be. And so it's a huge role. And that's one of the things, in our intake form, we like to ask, obviously with health history, what's going on, but, history of diabetes, things like that. And I'll usually ask it to them too. What's your diet like? Because a lot of times if they're drinking soda all day, every day, and not just saying, I don't want to just look at soda, but there's a lot of sugar, obviously we know, that's involved with that. And then whatever crap they're eating can obviously inflame the body. And, if the body's always inflamed, it's going to be tough, even from what we do, to calm down the nervous system and the body and the tissue, that it's still on overdrive with inflammation from what they're eating. So it plays a huge role. Nutrition does. And I actually had a nutrition certification as well. So it's near and dear to me.
See, that was something I didn't know about you.
I know. So it's been near and dear to me. And it's, again, I just got it because I wanted more information, more knowledge on it. We get a good bit in school.
In chiropractic school, you get a good bit on nutrition. That's interesting.
That was probably one of my favorite professors, was our nutrition professor. And
it makes sense with the inflammation. Truly, it does. Mm-hmm. But I would have thought that surprises me.
Yeah. Huh. We do. We get a couple courses in pharmacology as well.
Okay.
Very basic, but enough to know what medications patients are on. But nutrition obviously plays a huge role because, if they're not getting better, okay, we can look at this, and this is definitely playing a role in why they're not getting better.
Interesting. So tell me your thoughts around red light.
Red light
therapy.
Yeah. So we work out of North Spring Rejuvenation Center, and that's one of the therapies they offer there. It has a lot of great benefits. That's why you're seeing it pop up at gyms and spas, you name it, because it's really easy. You just stay in there or lay in a bed or whatever it is, whatever the application is, and get the benefits of it. So it's great for obviously the skin, cells, and there's only benefit in my mind with it. So I'm a big advocate for it. I should probably do it more myself.
I know.
But
it's because it's easy.
Yeah, I know.
Like literally it's easy. Yeah.
It is. So it's a great therapy that I think can also help with injuries too, accelerate the healing process. So that's another thing that can go along with it.
So if we were going to go back for just a second to employees and let's just, and in the workplace and trying to prevent different types of injuries. And it could be as broad as, just anyone who's working, or as small as a particular, construction, to your point. What would be the one thing that you would suggest someone be aware of in terms of their surroundings for the fact of risk management or preventing bodily harm? Like, what would be the one? Because to our point, we were talking earlier and people just go and do their jobs. Mm-hmm. Like, if you could give one bit of advice that said, I really think you need to be conscious of this, what would that be?
I would say situational awareness. Okay. Probably. A lot of times we're on autopilot, or we're thinking on a million things, whether it be things at home that are going on, and then we're at work, and you're really not focused on what you're doing. So a lot of times, if you can really assess your surroundings, see what's going on, and have that awareness factor, okay, there's a hazard over here. It's kind of like a pre-check before you do it. So I think that's one of the biggest pieces, mainly in construction, but that could be applied to, even in if there's cords on the ground. Right?
I swear that's exactly what I was just now thinking, because they're right next to us.
I spotted that, my peripheral. But so it's simple things like that we don't think on or don't look at that could really cause, you trip over that, all of a sudden you hit your wrist and we have a wrist fracture. Now there's, it's something seems silly that would cause it, but it can. So really being, situationally aware is pretty crucial. And that's one of the things that I picked up on with one of the companies we worked with when we were in electrical safety. We would do pre-check, self-check, secondary check of having a buddy check you because, you do the wrong thing, it could kill you, obviously, with electricity. And that was one of the situational awareness is where that came from, was just, we called it human performance training. So
I love that. Yeah. I honestly think in any line of work that could probably be used, especially as a business owner. Like, what would you suggest if a business owner called to you and was like, okay, I don't know, like, I've just created this workplace and I need you to come in and like double check me to make sure if there's something I can do better. Is that something that is available?
Yeah.
And maybe not you necessarily, but maybe.
I actually have done that.
Okay.
So there was a company in Cleveland, Tennessee, and we did, I was there. My wife set it up. I was The grunt.
That was the grunt.
But I did ergonomic assessments on every employee, checked their desks, saw what was going on there. And it was a new building to them, new desks, new chairs for a lot of them. So it was a great time for me to be there and do that with them. And then also look at their data warehouse. So going through basically a whole checklist of any of the things that could pop up for OSHA hazard. That's really where you can look at. And again, I don't always see OSHA as a bad thing. It's more they give you guidelines.
Sure.
And as long as you're doing those guidelines, you'll be fine. But it does help to avoid a lot of injuries.
They're trying to keep you safe at the end of the day.
They are. There are some overkill. There can be some. But primarily, if you go over that checklist, it does give you some indicators. So that is one thing that I have done with companies. And then we also just do it from even more kind of a lesser standpoint as well, where like one of the companies, I provided stretching routine for them. So that was something we did in construction, was basically a morning routine where we would go through as a team and do the stretches together to warm up the bodies for the rest of the day. And there's a company here in Chattanooga that I do that with. And then once they've done it for so long, we'll come up with a new group of it. And obviously with technology nowadays, with like ChatGPT, that can help tremendously, because now we can gear it towards more it would take me a while to do it, but gear it towards more of their profession, which is welding. So that's a whole nother bag of worms.
They do a lot of squatting and getting in odd
Bent
positions.
over,
One of my sons is a welder, and he just gets in these odd positions, and then the arcs are falling on him, and it's just a whole wealth of craziness that goes along with welding for sure. But that could be said for lots of different jobs for sure. So if you were looking at a client that came in and said, listen, I've tried everything. I have done the diets. I have done the sleeping. I have done everything, and I've still got this pain. What would you say to them in terms of saying, hey, my chiropractor wants to come check out my workstation? What's that? How does that conversation look?
Well, it's just figuring out what have they tried? Because a lot of times we try things, we'll do one thing at a time. Right. We don't piece everything together, right? They went on a diet one time, or
and that's fair.
And that's what a lot of times we see. And people will say this too. They'll be like, I tried chiropractic one time. Well, you just tried adjustments. You didn't try anything.
It's different.
So, and to their credit, they're trying all these things, but a lot of times you need to put everything together to get somebody better, because there's a lot of systems with the body, right? So even analyzing a workstation can be one of those factors.
And I'm sure they could probably send you pictures of their workstation too, right? Okay.
Yeah. And patients are usually pretty good about talking about it. And it, having worked in those settings before, like I said, it kind of gives me a leg up to kind of picture what they're going through or where they're working. But it's even better when we get to go to the company and actually work with them, because we can watch them real time.
And their neighbor's like, now, wait a minute, I'm sitting like this. And it's a spin-off effect. Understood.
So it's pretty contagious.
Understood. So in our line of work, we deal with a lot of people who are exercising. I exercise a lot. I do not go and see a chiropractor. I don't think anything about it.
Yeah.
So tell me, when is a good time, and you might say anytime, but when is a good time for a person who I just don't think, I'm not against it.
Yeah.
I just don't think anything about it.
No.
When is the call to chiropractic?
That's a loaded question. It's different for everybody. Now, obviously, a lot of people will come and seek me out because of pain, right? That's what they look at. I'm a big advocate of maintenance care. Now, my maintenance care is a little bit different. Everybody's, even I always joke with patients. I'm like, I like seeing you, but I don't want to see you that often. So a lot of times, some of them will space out, or I'll see a patient every 3 to 4 months. But I would say a lot will fall in, and again, this is just geared towards more maintenance, fall kind of in that 3 to 6 weeks category. Okay. Some people like it more. They're asking more of their bodies with whatever their sport or activity is, or their weekend warrior. So sometimes they require it. or they've been through surgeries before that now the aftermath we're kind of dealing with. I'm a big advocate for it, but I don't think it's like, if you're getting by without it, that's great too. You're moving your body. You're finding, I am a huge advocate for exercise, and that's what I want my patients doing. So, there's a time and a place for chiropractic. Adjustments can do wonders. And it's not only your back, right? No. This is a great example. I saw one of the workplaces, this is a welding company. They sent an employee on Friday, and he's had tingling, numbness, cubital tunnel syndrome diagnosed, had surgery from when he was 10 years old on his right elbow. He has had that numbness, and it's painful, and he's still working through it, but he's losing grip strength, things like that. That's pretty critical to what he does for a living. And it was a pretty cool moment. Again, this isn't how it always works, but I only adjusted his wrist and his shoulder and it was the lightest shoulder adjustment ever because he's never done this before. But again, those two areas, what do they correlate back to? The elbow, right? And then I just did a thing called mobilization. So it's a lot of times what physical therapists will do as well, where you're not adjusting the joint, you're just kind of loosening the joint, so to speak. And we did some soft tissue treatments. Anyways, just to show you, I don't always adjust the spine. It was more the elbow, but he didn't feel numbness for the first time in 20 years. Wow. Now, how long that lasts, he's going to go back to doing the same things, right? But he right then was like, I want to keep coming back and doing this because it's helping. But that's one of those pieces is like when it's chiropractic right, or when it's physical therapy right, or whatever it might be. Sometimes we wait too long for things. Even if we notice something, we ignore it and just keep pushing on, right? And a lot of times if we listen to our bodies, that's a great time to, maybe focus on one of those things like chiropractic care. I love that. I've always said that I try to listen to my body, but I didn't always speak its language. So it's like speaking a foreign language to me, and I'm like, okay, whatever. Yeah. And then once you learn how to speak, you're like, I am so sorry. I'm so sorry that I did not do those things for you. So and totally understand. Yeah. And that's one of those things people will say, they're like, well, I hear once you do chiropractic care, you have to do it forever. That was the next thing I was going to say. And I'm like, nobody's required to do it forever. Yeah. It's just, you feel good because now your joints are moving better. And again, most of your joints are moving because we have so many vertebrae in our body. Yeah. If they weren't moving, then we would be stiff, right? But and that's what I explain usually in an educational piece with patients that, hey, our body's kind of like a joystick, right? The joints all move harmoniously together, but when one is restricted, that can be the culprit, and over time can cause issues in other places. So that's what we try to identify, what areas need to restore that motion to the vertebrae that aren't moving appropriately. Love that. Yeah. Love that. So tell me, if someone that's listening today wants to come and see you, how do they get in touch with you? So they could go through our website, keytochange.wellness.com. And through there's booking links. They can also call us as well. And my email's keytochange.chiro at gmail.com. So a number of different ways. Okay. But most people usually call or text, and that's an easy way to set up an appointment. And again, we usually start with that strategy call just to make sure that they feel comfortable. Again, we get to talk about what's going on because I don't want to waste their time if it's something that I feel like they need more medical attention or I'm not the right provider for that. I want to get them to the right person. Sure. Right? So that's where a lot of times we recommend it, but usually if it's a warm referral from somebody or a past patient, they'll just directly book with us or call us. I love that. And where is your office located? We're over off of, what is that, 14th Street? So right across from the stadium within North Spring Rejuvenation Center. Yeah. You know where that's at? Okay. I'd heard of them, but I didn't know where they were located. So yeah. Okay. Yeah, it's kind of hidden, but a lot of different things going on there. There's massage therapists and chiropractor, physical therapy. There's a gym. There's acupuncturist. There's a med spa with a nurse practitioner. Yeah, or with a nurse. So there's a little bit of everything. A little bit of all of it going on.
Well, thank you so much for joining me today. I appreciate it.
Thank you for having me.
Oh, no problem. No problem at all. Come back soon. So bring your wife with you next time. We're going to get the dirty on all of everything. Until next time.